Is that too high? If you sign up for a PAO or you're considering doing a PAO, like it will definitely affect everybody that you know for 3 to 4 months of your life. Like it is a long recovery. It is very painful. But I am 40 and I did both hips and I'm doing great.
PAO is short for periacetabular osteotomy, the procedure to repair hip dysplasia.
This is what's going on. Your hip hurts because it doesn't have like coverage in it. So like instead of the ball and socket being like this, it was kind of just like that instead.
The diagnosis temporarily sidelined Emma Markins from competitive dance and cross country. But surgery at the Hip Preservation Center at Cincinnati Children's cleared the way for her to get back to doing the things she loved. From her experience, she offers this advice.
If you have a multi-floored house, I would stay on the first floor for at least a few days because you're still like on heavy narcotics and everything. So you just have to be like mindful of that because you think you're fine and then you almost fall and you're like, no, I'm not fine.
PAO for symptomatic hip instability or sometimes a reversal of the correct position of the socket, and dysplasia is one of the best, most predictable solutions we have to hip dysplasia. So it's great at preserving the joint, it's great at preventing the need for hip arthroplasty or hip replacement, and it's great at decreasing pain in patients who have, a pretty solid diagnosis of hip dysplasia and hip instability.
Dr. Whitlock and his team at the Hip Preservation Center at Cincinnati Children's also treat adult patients. Elbie Foote was 39 when hip dysplasia threatened her quality of life with her family. It was a difficult recovery, but her tips can help others preparing for the same procedure.
Get a recliner, borrow one, beg for one, just get a recliner. Use your pain medications the way that the doctor says. And just talking about your shower, and when you get out, you can't really reach for the towel. Like there has to be some help for maybe 4 weeks, and then you can start doing things yourself.
Gretchen Lemert also relied on family and friends as she recuperated after surgeries to preserve both hips.
So having people come and like hang out with me and play cards and play board games and watch movies and stuff and just keep me busy was super helpful.
She's no longer a competitive gymnast, but the surgery made it possible for her to appreciate what she can do.
Even just like walking around the zoo or I babysit. So like going to the park with the kids I babysit, like I would never be able to do that if I didn't get the surgery because I could barely walk like 50 feet without having extreme pain and having to like turn around and go back home.
That's our number one goal, is to have a pain-free, normal daily activity life, and everything else is a bonus.
Rachel Breitenstein dedicates time for all her patients' families to make sure they know what to expect.
When they wake up from surgery, that's when really the hard work begins. They are going to be in pain. I always tell patients, you will be in pain. Your pain will never be a zero, but we work with the pain team here to help get them at a tolerable level of their pain for them to be able to complete the activities of daily living.
But ultimately, it's really, they have to do the work. They have to do the exercises, the therapy, the strengthening, take their medication, wear their TED hose, and do all these other things while we're taking care of other patients. And so they do 95% of the work is what I kind of always tell them.
Moving around actually keeps you less stiff, keeps your muscles moving, it keeps the blood flow going, it decreases the risk of a complication like a blood clot. So it's very important to be out of bed, up on your crutches or your walker, moving around after surgery, even though it might be painful.
It is definitely going to grow you in all areas of your life. You're going to be challenged, but you can do it. I did it, and it is worth it. It's definitely worth it, and you will be better afterwards when you do it.
Trust your doctors, trust your team. They know what they're doing and that you'll get through it, and you'll be super grateful that you did it because I am.